So good afternoon, everyone. I just wanted to thank everyone for joining us today and discuss the important and timely topic of vaccine hesitancy. My name is Brian Beck, and I am the IPAC lead for the Niagara satellite of the Hamilton, Niagara, Haldimand, and Brant IPAC Hub, and will be moderating today's session. I'm relatively new to this role starting in May 2021 and have previously worked as a public health inspector with Niagara Region Public Health for the past 10 years with a focus on infection prevention and control. I'm also joined today by Sandy Narsansky, who will be assisting me today as part of the town hall. Sandy has started as an MCCSS IPAC champion to support congregate care organizations in Niagara in March of this year and has over 30 years of experience working in the local development sector. Next slide, please. Next, I have the pleasure of introducing Dr. Ailish Scallon, who will be our speaker today. Dr. Scallon graduated from the medical school at McMaster University and is currently completing the Public Health and Preventative Medicine residency program. Dr. Scallon also holds a Master of Science in Global Health and worked as a researcher through the McMaster Health Forum, collecting and synthesizing evidence in response to pressing health policy questions. And I really couldn't think of a more valuable set of skills than that during COVID and all the different changes and challenges we've gone through. We will also be joined by Dr. Azim Kazmani, who recently joined Niagara Region Public Health and Emergency Services as Acting Associate Medical Officer of Health. Dr. Kazmani attended McMaster University for medical school, followed by Queen's University for specialty training in public health and preventative medicine. Dr. Kazmani is passionate about upstream prevention of illness and disease through a focus on social determinants of health and health equity. Next slide, please. So prior to turning things over to our guest speaker for this town hall, Dr. Scallon, I wanted to take just a few brief moments of our time to review and touch on the role of the IPAC Hub. The IPAC Hub and Spoke is a new provincial funded initiative to help build infection prevention and control capacity within congregate living organizations. The purpose of the hub itself is to serve as a local point of contact and help streamline communications to receive IPAC-related advice and support. I am part of the Hamilton, Niagara, Haldimand, and Brant IPAC Hub, which is being led by Dr. Dominic Mertz from McMaster and Hamilton Health Sciences, as well as Boyce Marifov from Public Health Ontario. So just to give you some background itself, there are different hubs throughout Ontario, and this is the hub that covers our sort of catchment area. So as part of the Niagara Satellite Hub, I work closely with some of our local partners, including some of my colleagues at Niagara Region Public Health and Public Health Ontario, as well as some of our different support agencies throughout Niagara. Some of the available services provided by the hub can include education and training, support visits and assessments, best practice recommendations, and coaching and mentoring on IPAC best practices. On the slide here, you'll see some contact details for the Niagara Hub. So myself, my contact information is available there, my email as well as my phone number. I've also included Sandy's contact information as our MCCS IPAC champion. And as you'll see as we go along, please feel free to reach out and share or ask any potential questions that come up in the days ahead. So to get us started, I just wanted to briefly touch on a couple housekeeping items. So as you've noticed, while the webinar is in progress, the audience microphones will be muted. I'd also like to encourage you to use the question and answer box, which is available to ask questions, and it will be monitored during the presentation. So if something comes up, please feel free to use that option as well. As I mentioned at the start of the presentation, it will be recorded, and we will be sending the presentation around to the different organization contacts that we have. I'm mindful that there are some strong feelings out there when it comes to vaccination. I just would like to encourage everyone to remain respectful and make this an open forum to discuss some of those concerns. So thank you to all of those who have submitted questions in advance. Some of the questions posed will be addressed specifically within Dr. Scallon's presentation, and others will be addressed during the Q&A session towards the end of the presentation itself. So without further ado, I'd like to turn things over to Dr. Scallon to take things from here.
Thank you so much, Brian, for the very warm welcome and pronunciation of the name. I know it's not the easiest, so I appreciate it. And thank you to everyone for coming today. As Brian said, I'm hoping that this can be a really informative session for all of you, and I appreciate the chance to chat with you today. Next slide, please. So just a brief agenda of what we'll walk through today. We'll chat a little bit about vaccines and how they work, and talk about where we are now with our COVID-19 vaccination program in Ontario. We'll talk a little bit about how you can access vaccination in Niagara or help the people that you love or work with to access vaccine. And there'll be a good amount of time left at the end of the presentation for open question and answer. Next slide, please. So when we begin to think about COVID-19 and how we're vaccinating against it, I think it can be really helpful to think about how viruses actually make us sick. So it's sort of known now that we get COVID through our respiratory system. So if we come into contact with someone who's sick and we get virus in through our nose or our mouth, it enters our airways and attaches there. At the level of the cell, viruses themselves attach onto receptors and can actually inject their genetic material into our cells. And from there, our cells sort of become these little factories for this genetic information and replicate this virus. Until we're able to generate an adequate immune response against these foreign invaders, we can become quite sick. Next slide, please. So every so often, we're confronted with a virus that does a really good job of getting around our natural defenses and results in a global pandemic. There are lots and lots of viruses in our communities. And for many of these viruses, we have pretty good levels of immunity already because we've been exposed. But with a new virus like SARS-CoV-2 or COVID-19, there's no population immunity. And so that leaves us quite vulnerable. So what has the impact of COVID really been? As you can see here, I've taken just a screenshot of the World Health Organization data that we have so far. In Canada, there's been nearly 1.5 million confirmed cases of COVID. And that number, I think, exceeds over 200 million worldwide. There have been almost 4.3 million deaths from COVID-19. This is a very evolving threat, as I'm sure some of you have heard all these new mutations that we're concerned about. Delta is the one sort of on the top of our minds these days, and we'll touch a little bit about on Delta later in the presentation. Luckily, vaccination has proven to be really successful. And the push now is to make sure that people have access not only to vaccine, but also to information so that they can make informed decisions for themselves and help those around them to do the same. Next slide, please. You're likely aware that there are a few different vaccines that you can access in Canada at this time. So I just wanted to quickly run through the approved vaccines in Canada. There are 2 mRNA vaccines. So that's Pfizer, which was approved in December of 2020. And that's been approved for kids ages 12 and up. There are trials going on right now for younger children, but they haven't released the results of these trials yet. So as it stands now, 12 and older are able to access the Pfizer vaccine. Our other mRNA vaccine is Moderna, and it's quite similar, but approved for ages 18 and older. And it's also a 2-dose series. Our other 2 vaccines are what we call viral vector vaccines, the first of which is AstraZeneca, and the second of which is Johnson & Johnson. Now, Johnson & Johnson is just a 1-dose sort of regimen, but there is no supply right now in our communities. Next slide, please. So I've already kind of touched on a couple of different types of vaccine, but it's helpful to kind of go through some of the ones that you might be familiar with already. So when we get sick, as I mentioned, our major line of defense is our immune system. But when viruses like COVID are able to evade that immune system, we rely on vaccines to provide us with that immunity so that we can prevent severe illness. There are lots of different types of vaccinations. So I've already talked about the mRNA vaccines and viral vector vaccines. You might be familiar with some of the ones on this chart. So vaccines like the flu vaccine take full viruses that have been killed and present them to our bodies so that we're able to kind of recognize it and create a defense. Vaccines like the HPV vaccine or Gardasil take a particle that's really similar to the virus, but isn't actually the virus, and introduces it to our body so that similarly we can mount a response to infection. Today, for the purposes of this presentation, we're going to focus on the mRNA vaccines, Pfizer and Moderna. I think that this will be most helpful moving forward, as it's probably the vaccine that most folks on the call will be accessing. Next slide, please. Now, it's worth mentioning that there are some vaccines that do contain live viruses, like the measles, mumps, rubella vaccine. These vaccines are still attenuated or weakened. So the virus that is introduced to us typically can't actually get us sick. However, there are no COVID-19 vaccines that contain any form of live virus. And so the idea that COVID-19 vaccines can get us sick is not true. As I mentioned, AstraZeneca and Johnson & Johnson use just parts of the virus to prime our immune systems. Pfizer and Moderna use this mRNA technology. So if you'll recall back to when we were chatting about how viruses get us sick, how they inject us with their genetic material, mRNA vaccines actually build on this natural process. So they present just one tiny piece of the genetic material of the virus to our body to help us sort of build these blocks of immunity. Now, because this is just one tiny piece of a virus and not the whole virus itself, there's no way to actually get disease from these vaccines. Next slide, please. This is just a handy little infographic that came out of the University of Waterloo. I did my med school in Kitchener, and so I was proud to put some Waterloo material on these slides. And I find this really helpful to kind of go through the process of how an mRNA vaccine works in the body. So as you can see, they make a point of noting that the mRNA vaccine can't actually change your DNA on entry. Our cells basically read this genetic instruction that we're being given from the vaccine and start to create the kinds of proteins that are seen on the COVID-19 virus so that our body can start to build a response. Interestingly, the mRNA in the vaccine doesn't really hang around. It actually dissolves quite quickly once this process gets underway. Next slide, please. Now, the development and approval of any vaccine in Canada follows a very similar trajectory. So as you can see on this kind of infographic, scientists will run new vaccines through a series of trials. These will progress all the way from animal trials to large groups of volunteers. The results of all of these trials, including how well the vaccine works, any side effects we might be seeing, and it's just general safety, are all taken into consideration by Health Canada. All vaccines that are given in Canada have gone through this process and have been formally approved by Health Canada. As well, there's lots of surveillance continuing in this sort of post-marketing phase of these vaccines to make sure that they're doing what we need them to be doing. Next slide, please. I think it's very fair to have questions about how the COVID-19 vaccine got developed so quickly. It feels like we've been in this pandemic for about a decade now, but it's remarkable to think back to the start when we had no idea how we were going to defend ourselves against this new virus that we'd never heard of before. So I think it's important to just highlight some of the context around the vaccine development to sort of clear our minds on how this might have happened. The mRNA technology that went into the Pfizer and Moderna vaccines was far from new. Years of research had already gone into this technology, so scientists were really able to quickly mobilize in the event of this disaster we found ourselves in. Health Canada actually put a fast-tracked process in place so that they were able to review evidence as it was coming up along that sort of timeline of animal study to human trial that I just presented. there's something to be said for the fact that a lot of us were being affected by this all at once. And so we were able to collect so much data and so much evidence all at one time, which is quite unique to the situation that we were in. There's also extensive global collaboration. Some of you might have heard of Operation Warp Speed coming out of the United States. We found ourselves in a pretty unique situation in the way that countries were able to support each other in their research and with their funding as well. Next slide, please. When it comes to what's in the vaccines, of course, mRNA will be the primary ingredient in our mRNA vaccines, as well as a series of other fats, salts, sugars, and water. Now, I've heard concerns from some people that human cells can be found in COVID-19 vaccines. And so I just wanted to take this opportunity to say that this is not true. Embryo cells have been used in the past for vaccine development. And these are mainly from two embryos from the 70s and the 80s. Those cell lines have basically been cloned in order to inform vaccine development in present day. Now, to my knowledge, AstraZeneca and Johnson & Johnson did use these cells in their early development, but they are not ingredients in the vaccines. And these cell lines were not used in the development of the mRNA vaccines, to my knowledge. Next slide, please. So, now that we've kind of talked about the different vaccines and what's in them, I think it's important to look at why we need them at all. How effective are they? So just drawing your attention to this chart, you can see that vaccination across the ones that are available in Canada provide excellent coverage. Variants do pose challenges, but from what we've seen so far, these vaccines still remain very effective against all the identified variants that we've seen. I think the most important figure on this chart is hospitalization and death prevention. And as you can see, that number is 100% across all of our vaccines. It's possible that we'll see some variation in this number as new variants emerge, but so far we've seen that vaccines are extremely effective at preventing severe disease. Another common question is, if I've had COVID-19, do I need to get vaccinated? Because presumably I've built some immunity. And I think that's a really good question. The evidence is showing us that there's some protection if you've been previously infected, but this isn't as good as vaccination. A new study that was just released showed that there's a much higher rate of reinfection with COVID-19 following infection versus if you've been vaccinated. So in other words, if you're to be vaccinated, you'll have higher protection against infection from COVID. Next slide, please. This is some data that I borrowed from Alberta, but similar data is seen in Ontario as well. So this sort of maps out hospitalization among people who are vaccinated, have 1 dose of vaccine, or have 2 doses of vaccine. And so you can see the red distribution there illustrates people who have not been vaccinated. And you can see that they make up the bulk of patients who are admitted to hospitals. The green delineates people who have received 1 dose, and the blue, which is barely visible on this graph, delineates those who have been fully vaccinated against COVID. Next slide, please. So another common concern is whether or not vaccination is safe in pregnancy. It's difficult sometimes to get data on people who are pregnant because we can't ethically include them in early trials of new interventions. And this was very challenging early on in our vaccination effort. Now, people, of course, have the right to make their own health decisions. And so there were many people who decided to access vaccine and who were pregnant at the time of vaccination. And so we were able to take advantage of that by looking at the after effects of vaccination through sort of surveillance data. One such study in the States looked at whether there were any increased risks or adverse events in people who were vaccinated and pregnant, and this included more than 5,000 people. And this data, which came out in May of this year, showed that there was no increased risk in adverse outcomes. No effect on future fertility has been found among these vaccines, and they've been found to be safe while breastfeeding. Scientists have actually looked at the components of breast milk from people who were vaccinated feeding their babies, and they found that there's no vaccine in breast milk whatsoever, but there are in some cases, COVID-19 antibodies. This is a very natural process by which people who are breastfeeding pass their natural immunity on to their babies. And so I think scientists were quite excited to see that. It's worth mentioning here that with new variants, pregnant people are more at risk of severe outcomes following COVID-19 infection. The Alpha variant in the third wave led to many more pregnant people requiring ICU admission following infection. And I think that the data is holding true for this fourth wave that we're sort of staring down at the moment. Next slide, please. Now that we've kind of reviewed a lot about vaccines, I think it's important to chat about how you can actually access one. Whether yourself, you're looking for one, or if you have people in your family or your circles that you're hoping to get connected. Next slide, please. So in the Niagara region, there are a number of ways to access vaccine. If you go onto this website here, the niagararegion.ca, there's a really clear list of all the public health clinics and pharmacies that are offering vaccination. And now it's really wonderful. You're able to just walk in without an appointment at some of these locations. But if you're looking for ways to schedule this in, appointments are also available. If you or someone that you know is unable to leave the home to receive vaccination, there is an in-home vaccination program where people from the city might be able to come and provide vaccination where you are. And I've listed the phone number here where you can give a call and inquire more about that if that speaks to you. I just completed a month-long rotation at the Niagara Public Health Unit, and I was really fortunate to see the amazing work being done by outreach teams in the region to provide vaccination for people who might experience more barriers in accessing it. And so there are a number of different outreach teams providing vaccine for folks who might be living in shelters or encampments. And if you'd like more information about that, I'd encourage you to reach out to your local unit as well. Next slide, please. Niagara has done a really amazing job in promoting vaccination and making it accessible to the population. As you can see here, almost 62% of Niagara is completely vaccinated now, which is really great and moving towards our target. Next slide, please. I did just want to highlight the sort of discrepancy between age groups, especially as we're starting to head back into school season and people are going back to universities. We've got lower vaccination rates among those who are in the 12 to 30 age range. And so if you have younger people in your lives that are hoping to be vaccinated or have more questions, I'd encourage them to check out these resources. Next slide, please. So as I mentioned earlier, the Delta variant is really the dominant strain of COVID that is concerning to us now, and it's responsible for more and more infections. I updated this slide yesterday, but as of yesterday, almost 60% of the new infections in the Niagara region are attributable to the Delta variant. It's a more easily transmissible variant. It causes more severe disease. But as I mentioned, vaccination is very protective against this variant. The most recent statistics that we have show that 2 doses of an mRNA vaccine are 88% effective against disease. And more importantly, perhaps 96% effective against severe disease. Current models are showing that unfortunately we are entering a fourth wave at the moment, largely attributable to this variant. From my perspective, the timing of this fourth wave is concerning as kids are about to go back to school and those under 12 can't yet be vaccinated. Fortunately though, vaccination among people who are eligible has proven to be really successful and really protective. The minimum we need to get to is around 83% of the eligible population to be fully vaccinated. So with that percentage of people vaccinated, we won't achieve herd immunity, but we will be able to cope with the number of people who might end up in hospital. So we can expect to see that some cases and unfortunately some severe cases will continue to occur, but our hospitals will not be overwhelmed like we saw they were in the third wave. Next slide, please. So to review some of the things we've talked about so far, we've gone through the process of the COVID-19 development and how it was approved in Canada. We've chatted a bit about how vaccines work and the ingredients that can be found in them. We've talked about the safety of vaccines in different populations. And we've talked about the importance of getting vaccinated for both for the return to normal, but to protect those who are not yet eligible. And hopefully, I've done a good enough job of running through how you might be able to access vaccine in the area you find yourself. But of course, if you have any more questions about that, you're able to access that information on the Niagara region website. Next slide, please. Now, I think when thinking about addressing vaccine hesitancy, it's crucial to remember where people are coming from and how we can meet them where they are. For instance, recent survey data has shown that there is significantly more hesitance to get vaccinated among Black communities in Canada. At the time of this survey that was done earlier this summer, Black Canadians were 20% less likely to have received a dose of vaccine. We have to understand that factors like trust in the healthcare system, experiences with medical racism, and historical violence play a very big role in why some people from this community might be hesitant to access vaccine. A lot of people experience a lot of barriers in accessing vaccination. People who are experiencing homelessness or using drugs, unable to get time off work, living remotely, whose first language is not English, the list goes on. There are strong efforts happening locally to bridge these gaps, but it's essential that we're patient and that we're centering these voices in our push to vaccinate and to inform people. Next slide, please. So if you happen to be someone on this call who is hesitant yourself, or you have someone in your life who's unsure about the COVID vaccine, I found this resource to be really helpful. It's called the Vaccine Hesitancy Guide, the VH Guide, and it comes out of a group of physicians in Calgary. It walks through all the different sort of hesitations or questions people might have about the vaccine. And it sort of walks through how you can navigate these sometimes difficult conversations. Emphasized in this resource is the importance of actually listening to people and to understanding where they're coming from when they have these questions about vaccination. Next slide, please. These are just a few of the resources that I have used on a regular basis through the pandemic. Of course, the Public Health Agency of Canada website and the Government of Ontario website, and relevant to you is likely the Niagara region website. 19 to 0 is a really awesome site that I've used, also comes out of Calgary. And it's a group of interdisciplinary people who have come together to provide really clear, concise information on various parts of COVID and its vaccine. And lastly, just a point of personal interest, this New York Times article on how the Pfizer vaccine was made is accessible online and free, and does a really interesting job of walking through the process of how it's actually produced and shared. Next slide, please. This is just another list of my references, which can be found available online after the fact as well. Next slide, please. So I think I intentionally left lots of time at the end of this for questions, knowing that hopefully I addressed some of them through this presentation, but knowing that likely folks have some more thoughts to share or concerns that they might have. And so please do share either in the chat or however you're available or capable. Thank you.
Dr. Scallon, while people are thinking about their questions, I do have a few that were submitted prior to your presentation. You talked about the development and the approval process. One question that came forward was just regarding FDA approval. And if it is, why is it not? Is it FDA approved? And if not, why?
Yeah, so the FDA is more relevant to the United States. And so their vaccine process is sort of separate from ours, but Health Canada chain of approval that I kind of walked through earlier really speaks to the fact that these vaccines have to go through rigorous trials, spanning from those animal trials to small groups of volunteers to larger groups of volunteers before they're shared with wider communities. So definitely all vaccines that are being distributed are not experimental and have been approved by Health Canada. Thanks, Sandy.
A question just came in. In Canada, mixed doses are okay, but the World Health Organization says no. What are your thoughts?
Yes, so this has been a point of very understandable frustration. I know Barbados recently reversed their decision to not allow mixed doses of vaccine for people traveling into the country. I think this is going to be something that that continues to evolve. The WHO statement, however, I think was taken a little bit out of context when it happened, and it caused understandable anxiety among communities. So I think this was a statement that happened a few weeks ago, where the headline basically said WHO is not encouraging or approving mixed vaccines. And if you look at the transcript, they were actually speaking about experimental booster doses that some jurisdictions were beginning to roll out. So third doses of vaccine. Booster doses are still sort of being studied and haven't been formally approved to my understanding. And so, I think that there was just some miscommunication on the side of the media about that statement. The WHO has since clarified that mixed doses are up to our countries have to trust the data that we have, and Canada has formally approved this process. But understandable frustrations and confusion.
Thank you. This question is asking, most of my coworkers are already vaccinated, so why should I bother?
Yeah, that's a great question. I think that this concept of herd immunity was something that we were really gearing towards. And so, if all of your coworkers are vaccinated and you're not, presumably your coworkers are protecting you because they are immune to COVID, or at least protected against severe disease. More and more as these variants emerge, we're seeing that herd immunity might not be achievable for us, at least while 11% of our population isn't eligible for vaccine, being children under 12. And so in order to protect yourself and also protect the people in the community, I think it's essential that you access vaccination for yourself. If we lived in these little bubbles where we knew that 98% of the people around us were vaccinated, then herd immunity could be true. But from everything we've seen, it's sort of a moving target and might be out of reach in the short term.
Dr. Scallon, so following that question then, why do people need to wear a mask if they have been double vaccinated?
Yeah, another great question. So as far as I know, the CDC came out and said, and the CDC is sort of the governing body of health in the United States, and they said that if you're in a group with fully vaccinated people, then you don't have to wear a mask. I think in Canada, the approach we're taking for now, as new variants emerge, is to keep some of these public health measures in place while we continue to collect data and see how this is evolving. The statistics that I shared about we're 88% protected against COVID if we're fully vaccinated with an mRNA vaccine. That's obviously a wonderful statistic, but it's not 100%. And so while we're sort of continuing to fight our fight against COVID, these local public health measures, at least in Ontario, are still in place.
Thanks. And Mike is asking a follow-up question to that. So double vaccine covers you for 88%. What are the factors to come down with COVID in the remaining 12%?
That is a really great question, Mike. I was doing a little bit of reading about this beforehand, and honestly, I'm not too sure. I think in some people, for whatever reason, you just don't mount an appropriate immune response to the vaccine. But what factors might contribute to that, I'm not totally sure. I know Dr. Kazmani's on the call, and if he has any more insight, maybe he can enter it into the chat. But it's just one of those variables that I'm not totally sure has been figured out completely. Great question.
Dr. Scallon, I have another question. This is from Sandy. When do you think we'll know about the booster, and how often would boosters be required? Every 2 years, every 5 years, etc.?
Yeah, another great question. Thank you, Sandy. So some of you might have seen that the World Health Organization came out a couple weeks ago and asked for a moratorium or a stopping of boosters until we can achieve a more equitable vaccine response globally. So in Canada, of course, we're doing really well. We're actually global leaders in our vaccine effort. But some nations like India, who have been really strongly impacted by COVID, have really low levels of vaccine due to supply issues. And so I think that the booster conversation has kind of been put on pause until we can ensure that there's an equitable amount of first and second doses to go around globally. That being said, I think research is always underway in the background, but I think from the conversations I had when I was at Niagara Public Health, it's an effective vaccine, at least in the short term. And so I think we'd be looking at, if I had to guess, every couple of years. But again, that would be speculative, and I think that data will emerge once we are, globally in a better position to do so.
This next question was submitted in advance. Do we anticipate a fourth epidemic wave? And if so, will vaccinations become mandatory in certain settings?
Yeah, unfortunately, we're in the fourth wave, I think, officially now. Logging into my Twitter this morning it's always a humbling event. We're seeing a rise in cases that, as I mentioned, are likely probably attributable to this Delta variant. There's back and forth about whether vaccination will be mandatory. I know some workplaces are citing some legal concerns with making that a mandatory requirement for their workers, but others are going ahead and implementing this. I think Ottawa University, either yesterday or today, came out and announced that it will expect its students to receive full vaccination. And so this is another kind of evolving measure. But I think we're moving in the direction where vaccines will likely become mandatory in certain settings.
Following that, do we anticipate children aged 5 to 11 years old will eventually be approved to receive the COVID-19 vaccine?
Yes, so this trial is underway. It's Pfizer that's leading the charge on that, I believe. They are looking at, I believe, ages 5 to 12 currently in trials, with the expectation that they'll be able to report on some of this early evidence as early as September or October. Now that being said, once this trial data has been presented, it still needs to go through that rigorous process that we talked about earlier with Health Canada. And so the estimations that I've seen is that vaccination will hopefully be available to children under the age of 12 in the new year, hopefully early in the new year.
Dr. Kazmani has made a comment. I think it's important to note that any decisions on mandatory vaccines are made by the government. We simply don't know what the government will decide. Thank you.
Thanks, Dr. Kazmani.
This question was also provided in advance. Why does information about the COVID-19 vaccine change all the time? The World Health Organization will say one thing, and then it appears that they change their mind. This has affected my confidence.
Yeah, I think that that's completely fair, that it would affect your confidence. And I'm really hopeful that this session today has hopefully cleared up some of the process issues that we have with, an ever evolving situation that we're in. All of the data that we're collecting is new every day. And so giving the example again of the statement made by the WHO, not only are we working with new data every day, but there's also miscommunications between, scientists and media and community. And so it just happens every so often that messages get mixed up, or indeed that people's minds get changed about what might be safe and effective as more evidence is available. If we look at the AstraZeneca vaccine, for instance, as the side effect of blood clots, though very rare, became more of an issue, the National Advisory Committee on Immunization sort of pivoted and said, rightfully so in my opinion, that mRNA vaccines are preferred. I think this was really stressful for a lot of people who had already received AstraZeneca, or who might be, booked to receive their second dose. But it's another example of having to make decisions once we have more evidence, and trying to provide that in a timely manner so that people can make informed decisions for themselves.
This question just came in. Do you think that we'll see another lockdown or a reversal in stages for the fourth wave?
Yeah, thanks, Sandy, for the question. I don't know that I'm in the best position to comment on whether or not there'll be another lockdown. Similar to, decisions on mandatory vaccination, those decisions will be made by public health leaders. I think what I will say is that if we're edging towards this target of 83% vaccinated, I think then we're in a pretty optimal position where if we have enough people vaccinated, our hospitals won't become overwhelmed, our ICUs won't be over capacity, and we will hopefully be able to avoid a big lockdown like we've had previously. I think we're all kind of in a period now where we're quite tired and burnt out by this pandemic, understandably so. And so the further we can get along our vaccination targets, the better chance we have to get out of this thing.
A question that was from earlier. Why do people who are fully immunized, even 2 weeks after their second dose, still get COVID-19?
Yeah, so this is similar to the question that was asked earlier about, what's that 12% and why do they still get COVID? And it's a really good question. I think, for whatever reason, vaccines just sometimes fail. And that virus is good at making its way around our immunity and our defenses and still makes people sick. I think really the number to focus on is how effective they are at keeping us out of hospital. And that number is 96% effective. And so, I think while some people do get sick after 2 doses or still get diagnosed with COVID-19 after 2 doses, the likelihood that those people will end up in hospital is very, very, very slim. And so I think that moving forward, I know Dr. Moore, our new Chief Medical Officer of Health, has said, really the stats we need to focus on are hospital and ICU admissions.
Those are the questions that I had that were previously submitted. So if anyone has any further questions, you can add them in the Q&A or the chat.
So not seeing any further questions. I would like to thank Dr. Scallon today for providing an informative session for us all. And thank you all for those that posed questions in advance to really kind of guide some of the material that was discussed. So, moving forward, just as we kind of wrap things up here, I'd also like to extend a big thank you to Michelle Johnston from Niagara region, as well as Shelley Mercer and Sandy Narsansky from Bethesda. Thank you for all your efforts in putting today's session together and making sure things were a success on that side.